Acne is very common condition and I get 70 to 80% of my patients come to my clinic for acne treatment. So let's discuss complete about the acne. Hi, I'm Dr. Nirja S. Nelogi, consultant dermatologist at Glow Skin Hair Laser Clinic located at Andheri West, Oshiwara, Mumbai. Before discussing the pathophysiology of acne, let's discuss about the sebaceous glands and pilosebaceous unit. Sebaceous glands are minute glands. They are present in the mid-dermis and they are present all over the body, but their density is more on the face, scalp, chest, shoulders and back. They almost grow along the side of the hair follicles and they open into the same follicular canal that of the hair, and it forms a pilosebaceous unit. Normally they secrete a sebum which nourishes the hair and the skin. Once the child attains puberty, the secondary sexual hormones start flowing in our body, especially the androgens. That under the influence of androgens, sebaceous gland secretion starts more, and also the follicular plugging starts keratinization. Due to the keratinization and increased sebum, it forms a comedones. Clinically, we see as a closed comedones and open comedones. Open comedones are due to the oxidation of the melanin pigment, it appears black. And closed comedones, we need to stretch the skin and feel the closed comedones. Coming back to the anatomy, the normal skin has a microbial flora called Propionibacterium acne. It is present on the follicular canal and the sebum. Once it gets the rich sebum and follicular plugging, keratinization, this Propionibacterium start multiplying. Once the multiplication number of the bacteria increases, the enzyme level increases and the inflammation starts. Further retention of the sebum and keratinous plugs cause rupture of the sebaceous gland. This clinically we see as a nodule. Confluences of these nodules, the surrounding sebaceous gland forms a cyst, and once the cyst and the surrounding inflammation all heals, it forms a scars. The size and pattern of the scars depends on the size and pattern of the acne they had, and also the genetic susceptibility. This scars causes disfigurement of the skin, and it's so dreadful to both patients and the doctors to treat the scars. Treatment of acne depends upon the nature and course of the acne. The patient has to understand it comprehensively, how is it, and next they have to adhere to the treatment regimen strictly. They have to remove all the wrong notions related to the acne, like because of bowel disturbances they get acne, or because of impure blood flowing they get acne. All these notions has to dispel, and the popping up of the acne will remove it fast. All these wrong notions they have to stop, and especially in village side I have seen they are applying the toothpaste on acne. Please stop all the wrong notions. And next second, if they are taking any medications related to acnegenic, like example phenytoin or any androgens related, if they can, they have to stop it. Application of the oil, pomades and heavy cosmetics which leads to the obstruction of all the sebaceous secretion will leads to the acne. And the stress level they have to manage. Because of stress, the cortisol level increases in the blood, and this cortisol will lead to hyperinsulinemia. Hyperinsulinemia will lead to androgen synthesis. This androgen will again influence or stimulates the sebaceous gland to secrete more sebum. Again the cycle starts. Next, and the regular washing of the face with soap and water, it's a very helpful. They can use the deep cleansers to remove all the deep keratinous plug. Treatment of acne depends upon the grading of the acne, severity of the acne, extent of the acne, like how much it has spread to the chest, back acne, and scarring of the acne. It also depends upon the psychological effect of acne, how much the patient has affected by this acne, and depend upon the cost and previous treatment regimen, what patient had gone through, what the results are there. It all depends on that. Grade 1 acne, where you see mainly of the comedones. In this, first the line of treatment is benzoyl peroxide gel. It is a bacteriostatic and anticomedolytic. Next is the salicylic acid. Salicylic acid you can use in the form of face wash, toners, peels. This is a comedolytic and it decreases the sebum production. Third one is the azelaic acid. This is well tolerated in many of the patients and the results are very good. Grade 2 patients where you see few comedones and mainly papules and pustules. In that condition, first is the benzoyl peroxide gel and second comes topical retinoids in the form of tretinoin and adapalene. We can also combine, if there are many pustules are there, antibiotic creams like clindamycin, erythromycin. Grade 3 is a severe condition in which you see a papules, pustules and nodules. In this condition, we need to give oral antibiotics in the form of doxycycline, minocycline, azithromycin. After discontinuation of these antibiotics till the recurrence of acne, then we can go for sevostatic agents like hormonal therapy or oral isotretinoin. Oral isotretinoin can be given. Grade 4 condition where you'll see a huge cyst and all this. So we can aspirate the cystic fluid and we can give intralesional steroid. We can also give oral antibiotics and sevostatic agents, especially the oral tretinoin helps. Adjunctive therapies for the acne are the peels. As I said, salicylic acid peel is the best peel to treat, and microderm abrasion, komedo extraction, laser or light peel photodynamic therapy we can use in this acne. General tips which I give my patients about the acne is first understand the nature and course of the disease. Second, and always wash your face with soap and water so that it removes all the excess sebum and keratinous plaque. Deep cleanser can also be used to remove all the excess sebum if they have. And third is, don't use the oils or heavy cosmetics which forms a layer and it forms a plug, not the sebum will come out. Then the inside the sebum secretion will lead to the antibiotic infections. About the stress level. If the stress is high, the cortisol level will increase and this in turn will lead to the androgen synthesis. Again, the acne cycle starts. About the diet like high glycemic diet, which is a more of carbohydrate load, this increases the hyperinsulinemia. This hyperinsulinemia will causes androgen synthesis. Gel-based moisturizers will be preferred more than the cream-based moisturizers. I hope I have covered all queries related to acne. If you have any more queries, write in the comment section. Please like, share and subscribe our channel and press the notification bell for further videos.